My dear learners and respectable viewers, welcome to our online class. Subject English 3rd, topic comprehending passage. So we will read out another passage. So read the following passage and answer the question 1 and 2. So let us read it. Jane is a student nurse and is still training. Last month, she worked in one of the hospital's surgical wards. She learned to set trolleys for sterile procedures such as surgical dressings, intravenous infusion, and catheterization. She carried out certain procedures herself and assisted doctors with others. She often had to go to the central sterile supply department to fetch sterile dressing packs. Sometimes she took patients to the X-ray department or to the occupational therapy unit. This month, Jane is working in the same ward as John. She is learning to nurse patients suffering from diseases such as cardiac infarction, cerebral hemorrhage, cerebral thrombosis, and pneumonia. At the moment, she is helping a staff nurse to give injections. The staff nurse is explaining to her the doses, action, and side effects of the drugs they are administering. The other nurses in the ward are carrying out various nursing duties. Some are doing bed baths. One is helping a patient to get out of bed, and another is taking TPRs. A doctor is doing a ward round and a physiotherapist is helping a pneumonia patient to do deep breathing exercises. So now we will just read out, or we will just know the meaning of some unknown words or words that are somewhat unknown. Okay, so sterile, free from bacteria. Procedure, way of doing things. Intravenous, within or into a vein. Infusion, fluid put into the body. Catheterization, draining fluids from the body with thin tube. Infarction, death of a piece of tissue because the blood supply has stopped. Cardiac, of the heart or related to the heart. Cerebral, of the brain or related to the brain. Hemorrhage, bleeding. Thrombosis, a blood clot. Okay, now we will just answer the question. Choose the best answer. 1 into 5 equal to 5. So let's start with multiple choice questions. Question number A, what does the word infusion means? There are 4 alternative answer or 4 alternative options are there. You have to just find out the correct one. So to make safe, to treat a patient, to give blood, to put fluid into the body. So from reading the passage, we know that infusion means to put fluid into the body. So the correct answer is to put fluid into the body. What do you mean by sterilize? Here in this passage, number 1, to make free of bacteria, to make free germ, to make impotent, or to make energetic. So the answer is to make free of bacteria. Question number C, what is hemorrhage? Coughing, trembling, bleeding, breathing. Answer is very clear and is easy. Hemorrhage is bleeding. So the answer is bleeding here. Number D, the word cardiac is related to. So we know that cardiac is related to heart. So the options are head, heart, lung, stomach. So the right answer is heart. The word fetch refers to. The options are to take, to bring, to buy, to give. You know, the right answer is to bring. So let's check out those answers. Number A, to put fluid into the body. Number B, to make free of bacteria. Number C, bleeding. number D, hurt, and number E, to bring. Okay, now we will answer the following question. Okay, so let's read out the questions first. Where is Jane working this month? If we go through the passage, we will just get the answer. Which patient is Jane learning to nurse? What is the staff nurse explaining to her? What is the doctor doing? What is the physiotherapist doing? So now we will see the answer. Answer number A. This month Jane is working in medical ward. Answer number B. She is learning to nurse patients suffering from diseases such as cardiac infarction, cerebral thrombosis, and pneumonia. Okay. So answer number C. The staff nurse is explaining to her the doses, action, and side effects of drugs. And question number D. The doctor is doing a ward round. Answer to the question number E. The physiotherapist is helping a pneumonia patient to do deep breathing exercises. So this is how we can answer the question from the passage. Okay. So thank you so very much. Hope you've enjoyed the class and hope to see you in our next class. Till then, goodbye.